Why is it, sir, that you're so disappointed with India's political class? Why is it that you believe that in India's greatest hour of medical crisis, when our netas should have been leading the way, setting the example, demonstrating COVID appropriate behavior, they chose to put votes over lives? Dr. Bagai.
Good evening everyone. And whatever I say is completely without bias. We are undergoing perhaps one of the worst public health crises which has been unforeseen. What is the public feeling? Fear, untold anxiety, panic, and all this is not unfounded. There's been explosive transmission. We knew that the second wave is going to come. History has taught us too well. There is mesmerizing confusion, and there are mixed messages from the political leaders. They are the policy makers. And once we start embracing religion and politics, then science is dead and buried. That's bad company for science. We will take years for this recovery, either economically, medically, socially, and the aftermath of the long COVID. What have all these social events which have caused, the so-called super spreaders, be it religious, be it political, be it social, or whatever be the etiology, they are the worst man-made, self-destructing events and disasters which we've self-inflicted on ourselves. Internationally, we know if more than even 10 to 30 people gather together without adequate protection, without adequate distancing and no mask, this is a sheer disaster. These kind of events have an 87% attack rate. And we know that one asymptomatic carrier can infect more than 50,000 in 10 layers in 14 days. And we know also that when you have 1,000+ people in various gatherings who may be asymptomatic carriers, 45% of these gatherings are asymptomatic carriers, there is nothing left to chance then. We have asked for this to happen. And at least as far as Delhi NCR is concerned, after being in medicine for almost 38 years, I'm really sad that what's the cost of a human life? People are struggling. I'm not putting any blame game because that's not the correct way to go forward. We need all hands on deck. We need every possible resource put together, be it from political class, be it from our medical fraternity. We as doctors are tired. It's been 15 months. We live under every minute of perpetual fear. We don't know when we ourselves are going to get infected. More than 800 doctors in India have lost their valuable lives. More than 1.5 lakh of Indians have lost this life. Yes, it is a pandemic. But could we have done it better? If you ask me,
okay.
Yes.
Just the other day, Dr. Patra, the Prime Minister himself, none less, was telling us, ye bheed dekho, look at how big the crowds are. And he's the man who last year was setting the example, telling people to maintain 2 gaz ki duri, to ensure that they showed COVID appropriate behavior. Now yes, elections are important and the Bengal battle is a big prize for your party given its history. But should you not have put lives over votes? Till the other day you're telling us, look at the crowds that have come to listen to you, completely oblivious of the fact that each of those congregations was a potential super spreader event. And as those death cases rise, the toll of those deaths, each life lost, each person struggling for oxygen, each person whose family is struggling at this time to find a hospital bed, that, sir, is on you.
See, Rahul, in fact, you are absolutely right that as far as the political class is concerned, responsibility should be one of the most important ornaments of the political class. And our Prime Minister, our party has always exuded, has always shown this kind of responsible behavior, COVID-appropriate behavior. The Prime Minister time and again has appealed for a COVID-appropriate behavior. He himself has followed the behavior. Well, as far as this surge, this second wave is concerned, I would be quite frank to say that the last week or so has been quite dampening. It has been quite, I would say, saddening. And that's the reason as to why there was a latent phase, there was a phase in which we could have been more careful, but we went to the Election Commission. The Election Commission, in fact, took up up the matter. All the political parties held meetings with the Election Commission. There was a consensus drawn, and in fact there were certain Rubicons drawn by the Election Commission. We are also following whatever the Election Commission had to say, number one. Number two, the Prime Minister, remember, on 14th of this month, when the meeting of Prime Minister was held, Prime Minister was categorical in seeing to it that there was social distancing, 2 gaj ki duri, there was masking of all those who were participating, all those on the stage. So the protocol in fact gradually were in place since 14th of this month, and now we have taken a decision that no huge spread of these rallies, only 500 odd people at best can gather, and that too with all the norms in open spaces.